Hi friends, welcome to Entri app. I'm Dr. Anugraha here. I'll be taking Opthal and Dermat in the coming up sessions. Now, all of you would be aiming for the coming up casualty medical officer exam. Let me tell you something. The right strategy makes a huge difference. നമ്മളൊരു എക്സാമിന് പ്രിപ്പയർ ചെയ്യുമ്പം ഇറ്റ്സ് നോട്ട് ജസ്റ്റ് ഹാർഡ് വർക്ക്, അതിൻ്റെ കൂടെ കമ്പൈൻ ചെയ്യേണ്ട വേറൊരു കാര്യം കൂടെ ഉണ്ട്, ദാറ്റ് ഇസ് സ്മാർട്ട് വർക്ക്. So in this module, I have included the exam pattern, subject-wise mark distribution and one PYQ. So let's start right away. I'm sure all of us would have applied for the post, so you guys would be knowing the details, but just let us brush through it. So I'm sure you guys would be knowing the details of this exam, but let's just brush through them. The name of the post that you all have applied, that's Assistant Surgeon or Casualty Medical Officer. Scale of pay, it ranges from 63,700 to 1,23,700. So total marks, a paper is going to be of 100 marks. Okay. Now we'll go through each subject quickly. Medicine and elite specialties, it carries the highest marks, that is 20 marks. So more importance, actually ningal koodal importance kodukkandathu ningada final year subjects inana. Medicine 20 marks, OBG it holds 14 marks, surgery 14 marks, community medicine 14 marks, pediatrics 12 marks. So basically your final year subjects, from there you're going to get a large number of questions. Now we have the short subjects from anesthesia, critical care, forensic, PMR 6 marks varum, orthopedics 4 marks, ENT 4 marks, Opthal, I'm taking Opthal here, very beautiful subject, it holds 4 marks. Dermatology, though it Opthal 4 marks varunnallengilum, we have to study about 16 to 20 topics under it, but all easy topics, right? Okay, then dermatology comes for 4 marks, psychiatry also 4 marks. So idakke valare korchu marks ne varunallu, but you shouldn't leave these small subjects because they are very scoring, right? It can bring a huge difference in your rank, so don't leave the small subjects. Moving on. Okay, once you pass, let's all be positive. Okay, we pass the exam, then you will be called to attend the interview. Now interview lo there will be panel of doctors who are going to ask you questions mainly based on PSM topics, community medicine topics and administrative level questions. So let's see, what are the levels of prevention in public health? It is a PYQ, it's a very important question from community medicine, very easy topic also. What are the levels of prevention? Or asukhathine namakku engane prevent cheyyam? We have primordial level of prevention, we have primary level of prevention, secondary level of prevention, tertiary level of prevention, and one more we have additionally now, quaternary level of prevention. I'll tell you what you mean by these, because in every at least in every alternative question papers you get this topic. About primordial level of prevention vechale, you avoid the risk factors. For example, to a child you will advise them that don't eat junk food, right? It can cause obesity, hypertension and what not, right? Other health conditions, illness. So that is, see, when you avoid the risk factor, that comes under primordial. When you tell the child, see, cigarette smoking is bad for health, you are avoiding the risk factor. So that also comes under primordial. Next is primary. Now examiners in a primary level of prevention, this topic they like so much. Okay, so here a topic in the question varum, if you don't know the answer by any chance, you will know, but if you don't know, most probably the answer is primary. Primary level of prevention means it includes 2 subtopics, health promotion and specific protection. Health promotion we advise people on lifestyle changes. Okay, I'm giving you examples under each. Specific protection means you give vaccination. Okay, all vaccinations come under specific protection. Then you ask the person to wear helmet while driving a two-wheeler. So that also comes under specific protection. Now using mosquito nets, yeah, that comes under specific protection. Now moving on to secondary level of prevention. Or asugutane namakku secondary level engane prevent cheyyam. In secondary level of prevention, we have early diagnosis and treatment. ഒരാൾക്ക് അസുഖമായി എത്രയും വേഗം നമ്മൾ അയാളെ ഡയഗ്നോസ് ചെയ്യുക, ട്രീറ്റ്മെൻറ്റ് കൊടുക്കുക. സോ വി ക്യാൻ പ്രിവെൻറ്റ് ദ കോംപ്ലിക്കേഷൻസ്. ഓക്കെ, സോ ഏർലി ഡയഗ്നോസിസ് എങ്ങനെയാണ് ചെയ്യുക? ഒരു അസുഖത്തിന് എനിക്ക് പെട്ടെന്ന് നേരത്തെ കണ്ടുപിടിക്കണം. സോ ഹൗ വിൽ യു ഡു ഇറ്റ്? യെസ്, വെരി ഗുഡ്. You will do screening for that disease. Screening. See, for cervical carcinoma, you can do a pap smear. That is one example. Now, you can check the BP of patients regularly to see for hypertension. So, you screen the person. So, screening comes under secondary level of prevention. Adengane orthirikya? S is here in secondary, S is here in screening. So, whenever you hear the screening word, it comes under secondary level of prevention. Now, tertiary level of prevention, here already അയാൾക്ക് അസുഖമായി. ഓക്കെ, നമുക്ക് ഇനിയുള്ളൊരു ചിന്ത എന്ന് വെച്ചാൽ അയാളുടെ അസുഖം പ്രോഗ്രസ് ചെയ്യാൻ പാടില്ല, കൂടുതൽ കോംപ്ലിക്കേഷനിലേക്ക് എത്താനായിട്ട് പാടില്ല. സോ ദാറ്റ് തോട്ട് വി വിൽ ഹാവ് ഇൻ tertiary level of prevention. So, under tertiary level of prevention, we have disability limitation and rehabilitation. See, stroke vanna, if a patient is unable to move, we can give physiotherapy, right? So, that is one example of tertiary level of prevention. Now, see, okay, answer is already written. Pap smear for carcinoma cervix is an example of which level of prevention? ഞാൻ pap smear ചെയ്യുന്ന എന്തിനാ? It is a screening test, okay, to check for what? Carcinoma cervix. So, when I say screening, you will remember that S for S, secondary level of prevention. Moving on. So, let's start the race, guys. If you can incorporate at least 2 to 2.5 hours per day from your busy schedule into studying for this coming exam, hopefully you will pass with flying colors. Now, prepare short notes. See, it's always better to prepare your own handmade notes. It makes a difference in your learning journey. Have you heard about Thomas Edison? The one who invented electric bulb. ആള് എവിടെ പോയാലും ആളുടെ കയ്യിലൊരു നോട്ട്ബുക്ക് ഉണ്ടാവും. അപ്പം ആളുടെ ലാബ് എക്സ്പെരിമെൻറ്റ്സ്, ഹിസ് failures, everything he wrote that in a book. Okay, and he says, and ആളുടെ ഒരു famous quote ഉണ്ട്, the faintest ink can beat a strongest mind. എന്ന് വെച്ചാൽ എഴുതി വെച്ചാൽ in some time it stays in your, it may take some time, but it will stay in your mind and it will enhance your memory. Okay, it brings about a change in your knowledge. So you prepare short notes. We will be conducting mock test, attend them, okay, and be engaged in healthy competition. Okay? Compare with yourself, focus on your goals. So that's it, we have come to the end of slides. So this exam, let it be not just chasing a job that we all dream for. Let it be a stepping into a life full of service, dignity, compassion and purpose. I'll see you all in the coming classes. Stay blessed. Bye-bye.